Hi there, my name is Gonca. I'm a second-year cardiology fellow at the University Hospital in Zurich, and I'm going to present you our study entitled Antidysmoglein 2 Autoantibody Identification in Phenocopies of Arrhythmogenic Right Ventricular Cardiomyopathy, ARVC. ARVC has several phenocopies, including cardiac sarcoidosis, idiopathic outflow tract ventricular tachycardia, and myocarditis. Differentiation between these phenocopies can be challenging, but correct and timely diagnosis has large therapeutic impact. Recently, our group has identified a novel diagnostic autoantibody, anti-DSG2 antibody, in ARVC. This antibody has not been found in patients with other forms of heritable cardiomyopathy, such as hypertrophic or dilated cardiomyopathy. So far, however, the presence of this antibody in ARVC phenocopies has not been tested. Thus, in this follow-up study, we wanted to investigate this. For this reason, recombinant human dysmoglein proteins on Western blots were exposed to sera of 25 patients with sarcoidosis, which were all confirmed by histology, and 19 patients with idiopathic outflow tract ventricular tachycardia, as well as 22 patients with myocarditis. Clinical parameters were then correlated to detected antibody intensity levels using Pearson correlation. Cardiac involvement was found in 17 patients, so 68% of all sarcoidosis patients, as assessed by cardiac imaging with CMR and FDG PET scanning. Their baseline characteristics are shown here in this table in the middle. Most of the CS patients were in New York Heart Association functional class 2. LV involvement was observed in all patients, and RV involvement was present in about 60% of the patients. Conduction abnormalities were the main EKG findings, and 9 patients had a cardiac device. So coming to our Western blot results, shown here on the right side, anti-DSG2 antibodies were identified in 6 out of all 25 sarcoidosis patients, 24%. However, antibodies were absent in patients with idiopathic outflow tract ventricular tachycardia and myocarditis, as you can see in the bottom 2 rows. Notably, all sarcoidosis patients with positive anti-DSG2 antibodies had evidence of cardiac involvement, whereas anti-DSG2 antibodies were not detected in the remaining 11 patients with CS. In all sarcoidosis patients with positive anti-DSG2 antibodies, FDG uptake in PET scan, suggesting an active myocardial inflammation, was present, corresponding to a median standard uptake value of 5.6, as you can see in the green box plot below. In sarcoidosis patients with no anti-DSG2 antibodies, the SUV values were significantly lower, with a median of 0, shown in the red box plot. The Pearson correlation coefficient indicated a positive correlation between FDG uptake and autoantibody levels, as assessed by pixel count of the Western blot bands, as seen here on the right below. For all other clinical parameters and biomarkers we have looked at, no significant correlations were detected. So in conclusion, anti-DSG2 antibodies are not only a specific biomarker for ARVC, but are also found in CS. Antibody levels seem to positively correlate with disease activity on cardiac PET imaging. Larger cohorts are necessary to confirm these findings and better understand the underlying pathophysiology of positive anti-DSG2 antibodies as seen in ARVC. Thank you so much for watching, and I'm happy to take your questions now.